the Radiology Academy. Today class is bit hard for me just because the network issue in my place. I am at home today, so let's start the stream. Today's topic is about CT brain versus MRI brain. Like if you look closely, there is a lots of difference about CT or MRI, but CT have a particular information provided, but MRI will be detailed describe what is the inside of the brain, like what type of content in this brain. So let's start that. If you see, there is a enhancement area in the left cerebral hemisphere. It's little bit, if you see in first eye, it seems like bleed just because it's the enhancements look like there is a edema. There is a edema apart from this area, just because if you see in edema along with the bleed, it's sometimes questionable, is it bleed or there is any type of tumor in this. ये एनहांसमेंट के साथ कभी भी मतलब ऐसा इडीमा नहीं दिखाई देता है ब्लीड के साथ, तो इसकी वजह से ये एक क्वेश्चनेबल रिमार्क्स हो जाता है. और ऐसे प्रॉपर्ली द एरिया ऑफ इडीमा वाज प्रॉपर्ली visualized in this sagittal sequence, or here is the enhancing lesion. It's not just because the enhancement is not properly everywhere. If there is a bleed, it's like a bright similar pattern everywhere. Just because bleed whatever in this bleed, the component was same everywhere, but there is a, you can see the enhancement, you see it's not properly same contrast. Like I will show the MRI image so that it's much more clear view in MRI. Just because in MRI we created image with the cellular level, so it's more detailed image, hyper. So after that you can see the lesion in CT bright area. In MRI you can see the wall is in T2, the muscle is look like gray, so you will see the area of tumor. I'll zoom out to show how you can like think. तुम लोग ऐसे मतलब सोच के आइडेंटिफाई कर सकते हो कि ये जो एरिया है ये ब्लीड नहीं है, कोई दूसरा चीज़ है, और whatever it is, there is a proper outline of tissue. For the history of the patient have CSR weeks after maybe 4 to 5 years ago, like that. So recently she has suffering from headache, dizziness, or unexpectedly recognized by hypertension or diabetes. Recently, like month ago. So after that, patient have feel severe headache with dizziness, so she has admitted in hospital. So here is the history. According to history, if patient has some type of CA history, you can give most, like यदि कोई पेशेंट का कैंसर हिस्ट्री है वो केस में जो भी प्लेन एडवाइस होने से भी वो कॉन्ट्रास्ट देना चाहिए. सभी कोई पेशेंट का टीबी या तो सीए हिस्ट्री है तब मतलब जो प्लेन इमेज है वो आइडेंटिफाई नहीं कर सकता है. कभी कभी फास्ट स्टेज में एक छोटा सा लीशन रहता है, वो देखने के लिए कॉन्ट्रास्ट देना ज़रूरी होता है. तो मैं ये दिखा रहा था कि इफ़ यू सी द cerebral hemisphere of this image, here you can see the area of wall in this tumor is showing the similar tissue enhancement in T2, or other part of this element was fluid. Inside also there is lots of fluid. So we get back to the next sequence. We go to the next sequence. As you can see, in this image, I will clarify that I am not a radiologist, I am just a technician. So if I have take mistake for like it's a tumor or it's a abscess, so it's not like I don't provide any type of diagnosis. I just describe what is this, and when you can do the scan, it's help to identify there is a tumor or it's called abscess. So I show the image with the clarification of my end, also with the provided by radiologist for every cases. So I am not teaching you how to identify what is it tumor or is it abscess. I just show you the presentation. If you see that type of thing, what can you do? It's not properly diagnosed with my opinion. I just share my own knowledge, whatever I have achieved in 7 years of my experience in medical field. So you can see there is a edema in this cerebral hemisphere, or you can look closely in T1. Edema is look like darker, so its all area was little bit hypo, apart from the other area of right side area of cerebral hemisphere. So it's properly indicate that there is a edema, or in this you can look closely in this lesion, there is a fluid. So in plain scan you will identify lots of things. In MRI I will have to say that it's helped lots if you have watched the every sequence properly. So here you can see this is the DWI. This is the DWI and it's ADC image. ADC here it's little bit misplaced. It's the DWI or it's the ADC sequence. So we can scroll down to the you can scroll down to the lesion area in DWI and ADC. Here you can see, the lesion is bright both. It's not so sorry, don't move similarly. Here you can see in DWI it's not happening with both sequences showing in same image. So here is a DWI sequence. In DWI fluid is darker, but edema is little bit darker. It's not that much information with edema. If you want to see edema in brain, जब तुम ब्रेन का इडिमा देखने के लिए जाओगे तो फ्लेयर सबसे अच्छा सीक्वेंस है। यहाँ में देखने से डिफ्यूजन में ओनली ट्यूमर के ऊपर फोकस किया जाता है, जो भी लीशन है। यहाँ में देखने से पता चलेगा कि ये जो ट्यूमर है इसमें फ्लूइड कंटेंट है कहाँ में, और ये एनहेंस नहीं है। डिफ्यूजन में एनहेंस नहीं होने से भी जो लीशन है वो ट्यूमर हो सकता है। तो MRI में एवरीथिंग इज़ पॉसिबल, क्योंकि हर सेल का डिफरेंट एनाटॉमी रहता है, हर ट्यूमर का डिफरेंट एनाटॉमी रहता है। तो उसके हिसाब से हम लोगों को देखना होगा कि प्रॉब्लम क्या है। ये ADC में देखने से पता चलेगा कि जहाँ में फ्लूइड है ADC में, एडिमा है वो ब्राइट रहता है। ऐसे देखोगे एडिमा होने से ये जो ग्रीन बड़ा एरिया दिखाई दे रहा है ऐसा लाइट हाइपो होगा, और फ्लूइड होने से ऐसा हो जाएगा फुल हाइपो। तो इसके ऊपर बोल पाओगे कि ये जो लीशन है वो किस प्रकार का लीशन है। उसके बाद हम फ्लेयर में जाएंगे। जैसे कि पता है फ्लेयर में जो CSF है वो डार्क आता है। उसके अलावा जो भी फ्लूइड कंटेंट है वो ब्राइट दिखाई देता है। उसके हिसाब से देखने से पता चलेगा जो सेरिब्रल हेमिस्फीयर में जो लीशन है उसमें फुल्ली एडिमा है, क्योंकि जो TT सीक्वेंस है उसमें तुमको ये फुल्ली एरिया नहीं पता चलेगा कि कहाँ से कहाँ तक फैला हुआ है। लेकिन यहाँ में तुमको अच्छे से पता चल जाएगा कि जो भी लीशन है वो कहाँ से कहाँ तक फैला हुआ है। सो फ्लेयर इट्स मोर इम्पोर्टेंट कैरी इन ब्रेन। If you look closely, so here you can see the FLAIR image also. So after that, it's more important sequence for this patient, just because we think from the CT का इमेज के ऊपर डिपेंड करके हमको ऐसा लगा कि जो hypodense, whatever it is, the hypodense lesion, in this lesion there is no any type of bleed content, so it's properly indicate that the lesion is densely cell so that it's bright. ये lesion जो है वो ज़्यादा सेल से गठित हुआ है, इसीलिए उसका जो डेंस है CT में ऐसा ब्राइट आया है। नॉर्मल टिश्यू से ज़्यादा डेंस में वो है। और ये CA पेशेंट था, इसके हिसाब से एक मेटास्टेटिक डिपॉजिट मतलब जो सेल है वो मेटास्टेटिक है ऐसा रिएक्ट कर रहा है। Just because patient has whole history of cervix. Now we get back to the angio sequence. Here is a angio was properly visualized in this image. This one is bacillus artery. MRI ब्रेन का सेरिब्रल आर्टरी, वैसे पीछे से ये गया है, ये पोस्टीरियर सेरिब्रल आर्टरी जो एक्सियल में दिखाया था। ये सबका नाम ऐसे देखने से पता चल जाएगा। दिस if you see the image you will find whatever the artery name. So in this image you will see posterior cerebral artery, left right orthogonal, and internal cerebral artery, left, one is left, one is right. Also there is a vertebral cerebral artery. There is a no any lesion in this area. Lesion, there is a there is a no any bleed in this area. So we get back to the, I don't know what happening. It's when I am convert the image, it will be goes flip. Yeah, right now it's okay. You will see in the contrast image the area of the tumor was showing in T2 image, so it's more clear that the wall was clearly enhancing this contrast. So it indicates that there is a tumor in this area, and after that the surrounding area was edema. There is no enhancement in this abundance area of cerebral hemisphere. There is a edema in this area. So that's it for this case. It's a more important case just because if you look closely, here you can see the bleed type enhancement. In the past, most of the students, it's called bleed maybe, but it's not bleed. It's just a dense cell like structure. So here is the end of this session. If you have any question, just comment below, or next class will be started in the same time, so stay tuned. Whatever you want to learn, which case you will be have some type of confusion, just comment me. I will help you to figure out what can you what can you do with your problem. You can see in this patient the line like structure going through the followed area. It's called brachial plexus. If patient have some type of weakness in upper limb, or there is a pain in movement in upper limb, so the type of history was indicated that there is a problem in the brachial plexus, so it's important scan. I will present this scan tomorrow, so stay tuned. Next stream we meet in next stream. Let's end the stream today. Bye.